It's funny how when you get over the age of 60, you suddenly become very interested in anti-aging medicine. One thing I learned just in the past week is that as living things, all of us humans, we're absorbing light, but we're also emitting light, and we emit light until the day we die. So we're interacting with light all of the time. So conflict of interest, I don't have any. So a large area, 532 laser radiation for fat loss in the body. What am I talking about? I'm talking about a device called emerald laser. And the video that I'm showing you here is an adipocyte, a fat cell, and it's been hit with 532 nanometer laser light. And what it does is it opens up a transitory pore, and the pore remains open for 36 hours. And the fat cell eliminates all of its contents, its fatty contents. And you can see that in this video here. You can see it in this video here, where you've got fat cells that look like a bunch of grapes. They get irradiated by 532 laser, and they eliminate all of their fat, and they turn, I said they turn into raisins. They shrink down and turn into raisins rather than grapes. And in this picture here, you can see fat cells after they've been irradiated, and you can see the globules of fat in the interstitial fluid. And this image here shows very clearly, you can see the pore opening up and the fat coming out of the fat cell. So what does this mean? I think this is quite mind-blowing, really. And this has been developed into the emerald laser. So what is emerald laser? It's a 532 nanometer laser. It's class 2 laser, so a very low class. It's a cold laser, there's no heat. And it's designed with 10 laser heads to irradiate large portions of the body very quickly. It's very, very simple and easy to use. And it's designed to have a beneficial effect on the fat cells in the body, thereby affecting a reduction in girth of the body and a loss of fat from the body. So it's a photochemical reaction. It's not photothermal. There's no heat. What do you do in a treatment? You lie under it for half an hour, 15 minutes on the front, 15 minutes on the back. It's utterly painless. You do not feel a thing. You have a series of treatments, usually once a week or twice a week, usually 6 to 12 treatments. And generally treatments are followed up by lymphatic massage. We use Balancer Pro. So it's low-level laser therapy. You're not using high levels of energy. There's zero risk, zero downtime, zero discomfort, and it's a totally delegatable device in your clinic. Anyone can use it. And fat is not just redistributed to other areas of the body. We know this because there's a reduction in size of all body parts, even those that are not directly irradiated. And it doesn't raise blood lipids. In fact, it lowers cholesterol and it lowers triglycerides. So does it work? What's the research? Well, there's actually quite a lot of research. You'll be pleased to hear I'm not going to go into this in any great depth, but there's a number of research papers. And just to be clear, these research papers are double-blind and they're sham-controlled. They're sham-controlled with LED laser light, so LED does not work the same. It's used as a sham control in these studies. And in these studies, they allowed no or very, very minimal lifestyle modifications. So patients were expected to keep their same diet and exercise level, no weight loss drugs. And these studies consistently show patients losing 6 inches of diameter from their body circumferences after a few, usually very few, just 6 treatments. So this one's from the Mayo Clinic. Patients with a BMI of less than 30, randomized, double-blind, sham-controlled. 3 treatments per week for 2 weeks, so 6 treatments over 2 weeks, and measurements of the hips, waist, circumference, body weight, and BMI. And all patients showed an improvement all patients showed improvement, and the mean average total loss of circumference was nearly 4 inches, 10 centimeters. 24 patients, 68%, achieved a greater than 3-inch loss in size. And on average, they lost 2.8 centimeters from their waist circumference. Controls obviously didn't do so well. This is it in a graph, just showing that there's the volume loss from the treated group and not from the sham controlled. Another study here compared once, twice, and 3 times a week treatments showed that twice a week was ideal. And these patients had improved or reduced weight, BMI, waist to hip ratio, fat mass, fat percentage, visceral fat, and maybe most importantly, body area satisfaction, body appreciation, and quality of life. This is a very key study. So this study looked at patients with a BMI of 30 to 40. So we're looking at obese and morbidly obese patients with this. And they showed, again, an average of 10.52 centimeters loss of circumference, 71%, nearly 3/4 lost over 7 centimeters. And this study led to its FDA clearance for a BMI of up to 40. And again, shown in a graph. This treatment has also been shown to work very effectively for cellulite, which is something that we're just starting to look at in my clinic. So again, a sham-controlled study, and it showed over half of people having a decrease of 1 stage on the Nürnberger-Müller cellulite scale, and a significant mean loss of 6 centimeters in thigh circumference. So a 1-stage drop on the Nürnberger-Müller scale is actually quite significant because this scale only has 3 stages of cellulite on it, mild, moderate, and severe. So a loss of 1 stage is a significant improvement. So in my clinic, we are not doing a study, so we add in lifestyle modification as much as we can. We aim to do 1 to 2 treatments a week. We aim to do 6 to 12 treatments, depending on the patient. We follow it with lymphatic massage with the Balancer Pro, and we try to encourage lifestyle modification, eating better, drinking less alcohol, getting more exercise. Not an easy thing to do, but we do our best because we're trying to maximize our results. And we monitor results with a STIQ scan. A STIQ scan is a super accurate 3D body imaging software program. It measures the body circumference very accurately, all parts of it. It also measures all of the fat compartments, including visceral fat, lean body mass, bone density, and other things. So I looked at 12 patients, 12 of our initial patients who had completed 6 to 12 sessions of treatment. None were taking weight loss medications, 11 female, 1 male, aged 40 to 73, and their average starting BMI of 28. And on average, these patients lost 4.4 kilograms, but some people didn't lose really any weight. They lost fat, they put on lean body mass, but they didn't actually lose weight. So some patients lost a lot more than 4 kilos. They averaged a loss of over 3 kilos of fat mass and a reduction in total body circumference of 25 centimeters. And the average reduction of torso circumference of 18 centimeters. Their BMI dropped from 28 to 26.9, and in nearly every case, bone density increased by 0.1 to 0.2 grams per centimeter square cubed, which is quite a significant change. Their body fat decreased by 1.96%. Their lean mass decreased by 0.12 kilos, but actually their lean mass percentage increased. And patients lost visceral fat as well as subcutaneous fat. So although the laser itself might not be penetrating very deeply, it still had an effect on deep tissues in the body. And I think this is very key. Everyone's talking about Ozempic and drugs like that, but we know that patients on these drugs lose 15 to 60% of the weight that they lose is lean body mass, their bone and their muscle. And you do not want to lose muscle as you get older. Muscle is your longevity organ. You want to be preserving it as much as you can. And our patients actually increase their percentage of lean body mass. So here's a few of our patients. This patient lost only 0.3 kilos, but his body fat percentage dropped by 3%, and his lean mass percent increased by 3%, and he lost 9 centimeters from his torso. This is what his clinical pictures look like, but this is what he sees at home. So to my mind, this is cosmetic medicine in a lot of ways, particularly for men. And although in the talks that we've had at this conference, I've really concentrated on just the face treatments. The face is really only 4% of the body area. We should be looking at more of our patients than just their faces. This patient had only 6 treatments over 8 weeks, so this is 2 months. She lost 6 centimeters from her torso. She lost 4 kilos. Her lean mass percentage increased by 0.7%. This is her clinical pictures from the front. But with this treatment, we're treating the front and the back. It's a 360-degree treatment. And anyone who's overweight, I'm sorry to say, has a lot of back fat. So what happened to her back? She got this improvement here. So we're improving 360. We're treating the whole torso. We're treating the whole body. This patient, you can see a very significant difference on her STIKU scan picture. Over 3 months, she lost 32 centimeters. She lost 26 centimeters from her torso measurements, 5.5 kilos. Her body fat percentage reduced by nearly 3%, and her lean body mass increased by 2.7%. And this patient lost 9.2 centimeters from her waist. So the important thing here is that we're not killing fat cells, and we're not sucking out fat cells. Fat cells can regenerate anyway. What we're trying to do is to make fat cells leaner and more healthy. We're actually having a side effect of increasing bone density, and we're having a beneficial effect on energy, and it's having a beneficial effect on mitochondria. It's almost certainly anti-inflammatory in the body as well. So you don't want to kill your fat cells, right? It's an important store of stem cells in your body. It's important in hormonal balance, and it probably has a lot of other functions as well that we don't even know about yet. So don't kill your fat cells, make them healthy. And if anyone, I don't do liposuction, but if anyone here does liposuction, if they have an emerald treatment before you do liposuction, your aspirate will be much better, your treatments will be much quicker, and your results will be much better, so I'm told. So use emerald, lose girth, lose fat, including visceral fat. Don't lose, or in fact gain, lean body mass, gain bone density, treat cellulite, reduce your blood lipids, and have other metabolic benefits as well. Thank you very much. And I'll just add, there is an emerald laser set up in the exhibitors hall in the corner there. If you want to come and ask me any questions, I'll be there in the break after this. But you can have a look at it, and you can have a try for yourselves. Thank you.